Now for the next thing we are discussing, we are trying to actually look at a slight view on what epidemiology. Okay, so we are looking at women age as related to pelvic inflammatory disease. Women age as related to pelvic inflammatory disease. So group of women, are they likely to have pelvic inflammatory disease and all of that? Okay, so pelvic inflammatory disease, you know that it affects women of what? All ages, but it affects them depending on the age. Okay, it can be more common in some particular group of people, you know. So in adolescents and young women, that's between age 15 to 24, they're the highest risks of developing pelvic inflammatory disease. Okay, so funny enough, reasons is there's higher rates of sexually transmitted infections, there's higher risks of pregnancies and all of that. Okay, biological factors, cervical cells in younger women are more susceptible, you know, and those group of women, they rarely use condoms. They can be using condoms, but they are not actually consistent with using condoms, you know. Women in their 20s and 30s, they are still at a significant risk, because most of these women, they go into cheating, they are having multiple sexual partners, you know. So women in their 40s and beyond, pelvic inflammatory disease is less common, okay, because most of them, they are settled, they are not really promiscuous, you know. So however, pelvic inflammatory disease still occur due to maybe post-surgical infections, spread from non-sexual infections and all of that. Okay, so this is just a look on how pelvic inflammatory disease affects women of different classes. Okay.